Hi, I'm Dr. Ryan Novak, urologist at Grand Itasca. Kidney stones are deposits in the kidney that form from various salts. An analogy would be salt in a water glass. At a certain concentration, the salt continues to dissolve until it won't, and at that point it remains a solid at the bottom of the glass. That's essentially what a kidney stone is, just with different salts. Most commonly calcium is involved, but there are other salts as well. The biggest problem with kidney stones is obstructing urine flow. It can certainly lead to pain and discomfort. Many patients will have stones and be unaware. As long as they're not obstructing the flow of urine, they're typically asymptomatic or without symptoms. If a stone moves into an unfavorable location, in other words, it blocks the urine stream, the urine will back up in the kidney and the kidney will stretch, and the stretching is where the pain comes from. If that happens, most of the time patients will end up in the emergency room, or they'll try to take over-the-counter pain medication. If the stone is small enough, it can spontaneously pass. And if the stone is too large and it doesn't pass, sometimes surgery is needed to remove the stone. If you have unexplained severe pain at home, I would recommend being seen in the emergency department, at least to get a good diagnosis to understand where the source is. It makes it much easier to treat the pain when you know the source. We don't always find the source, but for kidney stones, we typically do. Imaging is very reliable. Usually patients undergo CT scans. And the CT scan will show the location and size of the stone, which then helps us understand the likelihood of it spontaneously passing versus requiring surgical intervention. While at the emergency department, an assessment is made whether or not the patient would be able to go home and take over-the-counter or prescribed pain medication and successfully pass the stone on their own. If not, then the recommendation is typically to see a urologist so that appropriate plans can be made. One caveat is if you present with an obstructing stone in the presence of an infection. That requires urgent management and typically just a stent right off the bat. The stent allows the urine to drain, which allows the antibiotics to work, and then the stone is actually treated on a delayed time frame after the infection is cleared. There are 3 surgical approaches to treating kidney stones. There's shockwave lithotripsy, there is ureteroscopy, and there's percutaneous nephrolithotomy. Basically, it's 3 different descriptions on the approach to providing energy to the stone in order to break it up and remove it. And there are certain restrictions, such as the location or size of the stone, that leads to the surgical selection. Most patients, however, do well with ureteroscopy. It's a definitive way of removing the stone in one surgery. Ureteroscopy is minimally invasive in that it does not require any incisions, and it's done through the urinary tract. Kidney stone prevention is a very important subject. Patients really have 2 options. One option is more of a generic recommendation that I would give any stone former, which is primarily focused on fluid and diet management. Increasing fluid intake, so your urine output volume is at least 2 to 2.5 liters every 24 hours. A low salt diet, supplementing with citrate, which is found in lemon and orange, and maintaining a moderate protein intake diet are kind of the generic recommendations. Patients also have an alternative option of doing a workup, which is urine collection for 24 hours. The workup allows us to test the urine to see what various salts are contained within the urine, which then allows us to make recommendations, sometimes even adding medication to prevent stones. Grand Itasca Clinic and Hospital, your health is our specialty.